Vita, Professor Vita Poštuvan, who is Professor of Psychology at University of Primorska and the organizer of this III conference, together with the magnificent team of people headed on this case at the level of organization by Vanya Gomboch, and with the help of Lucia Royce and many other people who constitute really a fantastic team of people based in Slovenia. I want to tell everybody that our center is growing and that we have a basis in Koper, but also now in Ljubljana and in Maribor. So we can be more tentacular in approaching suicide from various geographical point at least, but certainly our mind is open and the perspectives are there. I don't want to steal any other time to Vita. Vita will speak about schools and what happens in children attending schools, what could be the problem of suicidality among children, some epidemiological data, some preventative efforts, some postvention practices. So, Vita, the stage is yours. Please go ahead.
Diego, thank you for this introduction. And well, I hope that I'll be able to contribute with my talk, because I was actually, my automatic thoughts, maybe even listening to the earlier presentation, was like, what new can I bring to this conference? You know, what are the topics that haven't been addressed? But maybe even when I was selecting my own talk, actually focusing on the youth is something that we haven't had in the program so far. But also, I will maybe not talk so much about the clinical cases, but rather try to see that from the perspective of prevention and even postvention interventions at a school environment. So it's a little bit of a different point of view, and I hope that it will still be very interesting for the audience. So, and maybe I'll also share in between why actually I have been intrigued by this topic. But let me start at the beginning, and then we'll come to this. We know that for young people globally, suicide is the second leading cause of mortality, but nevertheless, youth suicides are relatively infrequent when we compare that with the older age groups. So not only older people, but even all other age groups, and even the increase of the incidence of suicides begins or is related to the age. So it's greater in the late teens compared to the early teens. In general, as it is for the adults, it is higher among males, among boys, but these differences are big if we look at the different countries, different genders. So it's not so, maybe these trends are not so uniform as they are for the adult population. But nevertheless, suicide is a major public health concern, just because of the first thing that I have said, so that suicide is the second leading cause of mortality. And you can see here the two pictures. So for the group below the age of 14, the average global suicide rate is 0.6, and for the 15 to 9-year-olds, 6.9. So if we compare that to the average of 10, 11 globally for the adults, this is, yes, lower, but yet we'll see maybe why it is really important to be attentive to this. I will not talk today too much about the risk factors, because I think this is something that we have addressed many times. But I have come across this psychological autopsy study that has been published 6 years ago by the Dutch group, and has analyzed gender differences in suicide-related communication of young people. So this has been a study where they analyzed how these young people that have died due to suicide have tried to kind of share the communication about their suicide with others. Either that was in the content of suicide notes, or maybe emphasis on suicide methods or preparations in the last months. And what to me was very interesting is because this comes back to maybe what we have already discussed in the previous session. How do we communicate? Do we know how to, or do we as adults know how to read the signs when the youngsters try to communicate suicidal messages to us? And it has been shown that the girls have an earlier debut of this kind of communication. They also have a higher frequency of explicit messages that refer to the suicide, and are often more directly saying that they are suicidal compared to boys. A lot of times they also try to communicate that because they want to focus on the coping and achieving some support in their crisis. But if you look at the communication that boys have, they often use more ambiguous messages. They dilute their messages in some humor. So it's much more difficult to actually see that they are suicidal. Now, you would think that for the girls, them being very direct, that would be also very easy to recognize them. But what happens, of course, is a lot of times the myth that we have in the lay public that someone that is addressing or saying that they will kill themselves will never do it. So it is a challenge to interpret and also to respond adequately to this kind of youth communication of suicidality. What also another recent study actually found is that in the last years, this events that happened just before the suicides have occurred among young people were, for example, suicide-related internet use. So young people have searched for the suicide-related terms. And in the girls, it was a lot of family mental illnesses or domestic violence, abuse of parental bereavement, bullying, current or impending exams or exam results, and physical health condition and self-harm. So I highlighted actually exam or exam results because this is, to me, a trigger that is not very often taken into consideration. It is there. We know from the healthcare providers that there is an increase of mental health problems among youth closer to the exam period. But again, looking into the statistics of deaths, that hasn't been so obvious many times. But for boys, the drug use and workplace problems was another issue. Now, if we look at the trends, the epidemiological data, what was published many times in papers around, for example, year 2000, 2010, is that the trends of youth suicides were decreasing. So, for example, in this study of Kyrie and Diego, they have shown a decline for both genders. And then another study, for example, from 29 OECD countries has also reported a decreasing trend in suicide rates among a little bit younger groups. So the first study is from 15 to 9-year-olds, and this one is from 10 to 19. But even in that study, they have shown that there are some countries show some also stable or increases in female rates, but it wasn't as a trend recognized yet. Now, what has been shown in studies a little bit later is that still there is, in majority of countries in Europe, a decline happening, but they have already looked up or recognized some exceptions, such as UK, where there were some increases. And the increases have started already in non-European areas, especially in Asia, for example. And this has been now kind of recognized in many more countries. And I want to emphasize that, of course, at this stage, the data from since 2020 is still very recent data. So we do not have in many countries very reliable statistics. Not the last statistics have come in. So it's very difficult at this point to say what are really the global trends. So therefore, what I did is actually I analyzed the Slovenian data, and we have to take into consideration that Slovenia is a very small country of 2 million people, so that the rates really need to be considered in a very careful manner. And it's more like just a case that I want to present, because this is my home country, and we have seen how these cases actually are presented in the society. So these are the trends for the 15 to 19-year-olds. The red is for female, the blue the males rates, and the green the combined numbers. And you can see that the trends are maybe showing a small increase. I have compared the averages in the last 10-year period, so five years from 2014 to 18, and then 19 to 23. And you can see that in most of the cases, actually, the statistics would say that there is something happening in this domain. But you can see that the trends actually go in line, so it's not like a big differences between the male and female suicide rates. Now, there is another story when we look at the youngest group. So this is from 10 to 14. And we can see that, for example, for the total rate, there has not been much difference. There was actually in the statistics a decline in the boys and male suicides. And in the female, we see a big rise. Now, I want to emphasize that there are very small absolute numbers here. So we talk, sometimes it's 0, sometimes it's 1, 2, 3, 4, and this makes these differences very big. And therefore, it's very difficult to give some scientific conclusions on that. But nevertheless, this averages do need to kind of bring more attention to this topic. And I think we need to really be aware that there is something happening. This was actually the reason why I started to look into the data. What are the other scientific or other trends saying, and how do we try to explain these trends? Because in a way, what we see in the data right now, so from what I showed, is that the youngest groups are the groups where there is something changing. Either that is the onset of the suicidal behavior is starting earlier, or even that the youngest group of girls have higher rates of suicidal behavior. That wasn't the case so much present in the last periods. Yes, and looking into this, there have been quite a few debates on why there might be this increasing trends in suicidal behavior among the youngest groups. One of the, for example, the countries where the suicide rates among the youngest are increasing are the US, where, of course, also the general population has an increase. So this is a country where there are a little bit of a different trends. And I'm just commenting actually from like an outsider on the country, but very strong, a strong reason how they interpret this rise is because there is also an increase in prevalence of depression. So the depression then leads to the suicide. Now, there have been debates of why the different age groups are depressed, and there is one, for example, data that is saying that the youngsters have a declining mental health and a decline also in well-being, and that leads then later to the increase of depression and further to possible increase of suicides. And in the middle age, of course, the economic hardships are the ones that are usually presented. But for example, the COVID-19 also showed a lot of changes in the trends of suicide among youngsters. So in some of the countries, they have shown that, for example, there was an increase of suicide attempts, especially by specific methods. during this time. And as you can see from the upper part of the slide, that has been actually higher in the youngest group. So for example, in this study, they have shown that 10 to 12 years, the suicide attempts have increased by 73%, and 13 to 15 by almost 50. So it seems that there is something happening with the youngest group. And also a study from Slovenia that came from the only 24-hour emergency in and outpatient child and adolescent psychiatry clinic, showed that within the period of COVID, there were statistically significant more patients with suicidal ideation accepted during this time. And they have also had more patients who had attempted suicides. Now, we need to be very careful when we interpret this data. Very recent review on this and a meta-analysis actually analyzed the effects of a COVID pandemic and school closures on self-harm and suicidal behavior in adolescents. And they have showed that, pandemic was associated with a decline of suicidal behavior compared to the pre-pandemic levels. If we look that into the community samples. So community samples showed actually a decrease, but then the clinical samples actually demonstrated higher rates of suicidal behavior compared to the community samples. So there, for example, they have showed an increase of self-harm by around 30%, and to the suicide attempts by 22.4%. So there is an indication from this data that we need to tailor the mental health interventions very specifically to the needs of the population. Another article that tries to answer the question why there are changing trends and increasing trends among youth suicides, and especially among younger age groups. For example, in this paper, the colleagues from UK highlight that there is an increased levels of distress reported by adolescents, which includes the financial crisis in 2008, which is quite interesting that had such a big influence, they say, on the change trends, for example, in UK. The social media use, cyberbullying, increased academic pressures, and broader concerns about the job prospects, financial security, and global politics. So it seems like the young people today are losing this feeling that the world is a safe place, that it's a predictable place, probably also because of what is happening in the societies. And probably, I think actually that the wars and insecurities were not something that is happening just today. We have to be aware that majority of us, or majority of people in this world, thankfully still live in peaceful times. And there were wars and very hardships happening before. But the way young people are today receiving all of this information is probably different than it was in the past, because right now, they have all the information very quickly available without any real filter, without any thought of how they're actually processing this information. There is another way of interpreting this increasing trends of youth suicides among the youngest groups is with the earlier onset of the puberty. That has been demonstrated when they looked at for example, the average age of the first menstruation. And it has been shown that during the last decades, this has actually declined over the time. So there is an earlier onset happening, and this was linked to the obesity, the chemicals, and the stress factors again. So it's something that we need to also take into consideration. So these biological factors that are behind these trends. And of course, we can't avoid the exposure to media. I will not bore you with the details of how much the youngsters are using the phones and the technology, because sometimes when I read this, I feel a little bit pessimistic. We already showed this pathological use of internet, for example, as being very highly associated with suicidal behavior in the Saley study around 10 years ago, or even more. Now, what the studies have also shown is that why the media is so important also for directly to the suicidal behavior is, of course, because youngsters, they make unjustifiable social comparison to the others. So they see what, for example, others have, how they feel, what they do, and what they are capable of doing or not doing. It is social media a lot of time represents a way to communicate their needs, even suicidal behaviors. And if they don't get any support when they communicate that, that is actually a very negative experience that may lead to further steps. But studies, for example, from colleagues in Oxford have shown also that a lot of the youngsters that have self-harmed have actually had a direct exposure to the self-harm related messages. So either some messages that are promoting self-harm, or, for example, showing the pictures of how to self-injure, or how the others have done that. So this actually might have been a trigger that has also led to the unfavorable practices. And of course, we all know the Werther's effect that actually is related to this. We have had, I have shown in the statistics before, we had 4 cases and an increase of the youth suicides in 2022, and we have shown with the Google analysis of what was searched during this periods, and there was an increase of searching for the words related to suicide in this period. So maybe, of course, that then has a vicious circle, because the youngsters, they actually are exposed because there is a bigger number of these events happening. Then they are also looking for this kind of messages. And of course, we all know how the negative copycat effects might be later on with that. Another thing that might lead to the changes in the trends are also society changes in terms of how we form social relationships. We know from other research that it takes around 40 to 60 hours to form a casual friendship, double of that to transition to being a friend, and then another 200 hours in principle to become good friends. Now, what we see as a trend in global is that the number of hours that adolescents spend together steadily decreased in the last decades. So they are less likely to go to the parties, meet up daily. And so this face-to-face contacts have decreased. What has increased were the feelings of loneliness among young people. And on the average, the young people with the lowest number of live social interactions and frequent use of social networks were usually in the loneliness studies those that are identified as the loneliest. And if we look at the loneliness studies, and I will not touch too much on this, but just to show you, comparing the different age groups between each other, on the lower left side of the slide, you can see the different trends looking into the social, emotional, and general loneliness in one of our Slovene general population studies. And we have shown that the youngsters are emotionally the loneliest subgroup. So it feels like there is something on the social level that has changed, and that has led actually for this group to feel the most lonely in terms of how they can share their emotional burdens, how close they feel to someone, and similar. Now, what are the implications of what I have said? So we have heard a lot during this last 2 days about the clinical implications. So how we need to form a good alliance and similar address the needs in terms of clinical implications. But how does that lead actually to the preventive measures, in particular in schools and also in postvention? I will now try to show you a little bit or tell you a little bit of what we are doing in Slovenia in our center. So our center is based within the University of Primorska, which is the smallest public university in Slovenia. So we are not directly, how should I say, established within the school systems, because we as a center are under the university level. But we first started to work on the topic of youth preventive actions within the European study SAILI that many of you, I'm sure, are aware of, where there was a strong, where we try to actually look into different components of the suicide preventive interventions and try to see which one of them had any effect. It was a big study led by Karolinska Institute. And since then, actually, when the study finished, we were able to secure funding, more or less steady funding. It was just a few years in between that so far we didn't have the funding to run nationally throughout the whole country. Luckily, we have a small country in that sense. Preventive workshops with the kids, and also I'll tell you a little bit more about it in the next slide. And we build it upon these experiences. So, of course, with that, with the collaboration with several other institutions, we have developed some guidelines also on how to act at the schools when suicide happens, so in terms of postvention. And what we are recently doing, we are trying to broaden the network of expanding the knowledge, not only to do this by ourselves as a center, but also do it more locally and to sustain the knowledge in the local communities. So why I'm saying that, because what we do actually at the schools is we do, of course, we have to first communicate how the preventive actions look like, but then we do screening, we do a lot of workshops for the students. We take care of the emergency cases that we do in an individual level, of course. Different colors represent the different types of interventions, as you can see on the bottom. We try to evaluate our interventions, and we do also special lectures or workshops for the teachers or for the parents. And this all actually addresses probably what Konrad would say, this suicide literacy. So about, you know, the risk factors, how to recognize a person in need, and how to act when there is a suicidal case. And we also follow up on specific cases if there is a need. Now, the question is, of course, how do you actually do the awareness programs? How do you do the workshops for the students? So this is that question, what to say and what not to say. We have analyzed in the past what are the components that actually work in the awareness workshops, which have shown in the SAILI study to be the most effective when you try to prevent suicidal behavior. And one important part is probably that we do not focus alone on really telling the youth about, for example, suicidal risks or about the epidemiological data, but we try to really talk about their experiences rather through interactive workshops, through different means, so that actually they will learn from the experience rather than having ex cathedra, for example, lectures. So what we have shown in the analysis of these workshops is that they give a space for addressing important mental health related topics, because it seems that talking about the emotions is still uncommon, shameful, sometimes stigmatized. And I would say from the recent evaluations also, a lot of times people just don't know how to do it, especially if we take into consideration that youth today is more lonely than they were, and that probably they spend less time together. So they don't have maybe the skills or the time or the opportunities to learn how to actually make good communication. So it's very important that we give them the opportunity how to learn the skills. So teaching skills in our workshops for the kids really goes through a lot of games, a lot of role playing, problem solving, and of course we also try to normalize that we all experience distress, and of course this very important component, learn about the emotions. A lot of times we still see that it's very difficult to name the emotions, to find ways how to appropriately express or verbalize them. So teaching skills and handling situations. Then another aspect of how youth suicide prevention probably can be done is discussing difficult topics. Now, this is something that already touches upon the mental health literacy. So we address topics like depression, anxiety, bullying, crisis, conflicts with parents and teachers, and suicidal behavior. But it needs to be a very open, accepting atmosphere, and it's much easier to do this when we have a lot of materials that actually lead to the discussion, whether that are verbal or written assignments. And it's actually the way we probably narrate these topics is very important. So it's not like just opening the topic, what do you do when you are depressed, but really role-playing it, trying out different options and similar. And in all of this workshops, a very important part is the promotion of social networks. So promoting different kinds of professional support on the one hand, so telling the youngsters where to find help, how to efficiently, quickly get support, because in Slovenia we do have quite a good system of having the school counselor services integrated in the school system. So that's something that each pupil, being in a primary school or secondary school, so that means from 6 up until 18, 19, they can actually enter a counseling offices without any restraints, without any referrals, waiting times, and similar. And this is a first line of support, so to say. Of course, maybe even talking to your teacher or parent before that, but in the counseling services, there are already some more professionals usually involved. And another part of promoting social networks is really promotion of peer support. We know from other studies that many of the youngsters will show some kind of signs of suicidal behavior, as I said at the beginning of the lecture, and probably their peers, their friends will be the ones that they address this as the first points of contact. So we in the workshops directly with guidelines try to encourage peer support, giving ideas how to help a friend in need. And that also might create stronger class bonds as an end result. But also indirectly promoting peer support by developing the empathy, because if we get to know each other in a deeper way, and we see that also a classmate of mine has problems, has same doubts and similar, this might actually make the whole classes much better. What we found in the evaluation of the workshops is that if you look what actually works, what the this is a study that we've done with the coordinators of this awareness workshops. They have said that the emotion that they could express their views and emotions in a safe environment without prejudice and fear of ridicule were very important or powerful aspect of the workshops. So creating the feelings of safety, acceptance, not being judgmental. And also on the other side, making the facilitator needs to be a person who the pupils can make a good connection. A lot of times they said it's much better if this is a young person. Now, while I'm getting older, I also think maybe even older people can make good connections with the youngsters. But at the same time, we need to take into consideration how to really make a connection with the youngsters. They connect in a different way than, for example, the adults. Now, what we also do in our interventions is we also do intervene when suicide happens at the schools. Now, this actually activities have developed from our preventive actions, because we were on the field doing the preventive workshops and activities. And then a lot of times we were contacted both in cases where suicide attempts happen, and at the same time when there were cases when there is some student who died due to suicide. So this was in a way a starting point from really the needs that the school system had. We try to address those needs with our interventions. So what we do right now as a center, we try to be very quick in responding to the cases where they call us to support in a way the school. So that means supporting the headmaster with their decision-making, helping psychologists or school counseling services with their decisions. So to respond to the crisis team, and also then to do debriefing sessions with the whole class, the class that lost the student, with the teacher, or with the parents of the peers, so not of the parents that have lost their child. So this is all done more or less in a group setting. But then we also do, for example, in the individual setting, we do some debriefings with the best friends or the mostly affected students, with the teachers that were maybe most affected, and also with the bereaved parents. Now, we are not a healthcare facility, so we keep this first interventions, like first psychological support or debriefing, to up to 3 sessions in terms of this individual support, because we believe that then the local communities need to take up the cases. And of course, what happens a lot of times is that the schools later on decide on, well, we also want to encourage the preventive workshops, so they try to also enroll in the preventive actions. And also, it has happened now in the last years that we were called in by, for example, working organizations where a parent of a deceased child has been working, and these co-workers wanted to know how should they support this co-worker, which to me was a very positive sign in a way, because it's, for example, I went to one of those sessions and it was in a car industry, which is something that, you know, it's predominantly male represented, and yet it felt like they really cared for the co-worker and wanted to help him. Now, what to do and what to avoid doing at the debriefing with classmates a few days after a suicide case. Of course, I think I need to say firstly that when a suicide case happens of a young person, at least here in Slovenia, there is a lot of intense and a lot of communication happening. And it needs to be respectful. So all of these people that are listed here, they usually call each other, call us. Everybody in a way feels like they need to intervene, they need to support these cases. And a lot of times we also get emails from lay public telling us, do you know that this has happened? You should be there, you should be intervening. And we need to, probably this is a Slovenian thing, that we need to think about how to navigate this system better, because sometimes it's even too much of this communication. But before we go to the school, of course, we need to have some needs assessment done. So we need to know what was the case like, what has happened, because it is a different case if, for example, suicide happened on the grounds of the school compared to, for example, if it happens elsewhere. How the classmates were involved. For example, sometimes there is the best classmate, they knew everything, and they were maybe besides the friend. And maybe in some cases they didn't even know the class, this mate very well, this friend. We need to organize the sessions, so in terms of the characteristic of the group, because of course the participants need to have a common, more or less a common experience of what has happened. If there are some that have been involved much more intensely, then maybe we need to think how to structure this. Because what we do, as you have seen in the other slide, we do the debriefings in the group. So usually with the whole class, or at least those that actually get approval of their parents to be involved. And of course, we have to prepare our team in terms of organization and of course, emotionally. And this is how we usually do it. I will not go into the details because I see that I'm lacking a little bit of time, but in a way, one of the first thing that we need to do in the practice that I a lot of times also give as an advice to the teachers when they ask me, so how should I now re-enter this class, is at least in Slovenian standards, I think this is very appropriate to express the condolences. Because we need to recognize that the class has gone through a traumatic event, and expressing condolences might be this first way of actually recognizing that. And then we of course explain the session protocol. We try to establish very safe environment, and sometimes there is a doubt whether the home teacher should be present or not. And of course the guidelines would usually say that we try to keep it confidential. We try to keep it, as a separate session without the teachers. But sometimes the kids also prefer to have the teacher there because they have a good relationship with them, and they also can actually feed in with additional aspects that the pupils didn't have before the death. And then we address more or less directly the event, how the pupils felt, how they learned about it, what were their thoughts, and then of course about the emotions. Sometimes we do not directly address the emotions, but we rather do that through some exercises, such as, for example, drawing the emotions, or trying to express it through some metaphors. And then we educate how to help yourself and others during this bereavement process. So we are going in a little bit backwards to what we have actually, what I have talked about in the preventive workshops. And of course, then we encourage some engagement in the rituals, create special memorial events, and reflect the whole process of this event and also of the debriefing. And if there is after the closing some critical cases, because we know that kids that have been exposed to suicide might also be at risk themselves, then we refer them further on. Now, I want to take a little bit of time to just show you how the postvention activities look like in our center. So you see that they are clustered. Once one event happens, a lot of times we need to engage in another case. So and of course, it also depends a little bit on the seasons, because obviously also among youth, more suicides happen in the spring. And of course, a lot of times we also need to follow up with specific cases. There have been cases where we have done a little bit of individual work because they were very specific. But what we need to be aware not to do is really to think about the time frame when this kind of interventions still are meaningful. Sometimes the schools call us 3 weeks after the suicide has happened. So this is a too long period to do this kind of debriefing. Then sometimes it has happened that we have came to the school, they actually didn't give us a proper information, and it was very obvious that the kids have moved on in a way. They didn't want to talk anymore. They had enough of engaging again in this talk. So it's very important that we do it in preferably first week, but even better in the first 72 hours after the event. And you see, pretending like nothing happened, or even there are some cases where students reported that the teachers, for example, they were so overwhelmed that they couldn't really hold their emotions together. So this is also another issue that really burdens the kids in the situations. Now, the last slide that I have is really how to prevent compassion fatigue in the teams that actually conduct this kind of work. I think this is very important, and it refers both to the preventive workshops and also postvention workshops. And I think it begins with how you take care of your mental health in general, but also then what kind of cases are there? So how can I reflect the cases in terms of how it resonates with my emotions? And a lot of times, of course, also cases differ in terms of how a big organizational burden they are. Some cases are very easy to manage, so to say, because they have someone locally that can manage it well. But sometimes it takes a lot of effort to organize the sessions. Intervision and supervision are very important, but I think a very, very important part is also the overload of cases. As I said, we are sometimes called in cases in a very short period of time. We have 1, 2, 3 cases that we need to attend to. And it's very important that you have, that you distribute as a manager, so to say, cases among team members, that they rotate in this task, and that they also work in pairs, so they can, take over some roles. And sometimes you even dedicate some organizational issue to one team member, and then there are others that go on the field to actually do the postvention. I think it also, of course, helps if you have trainings and skills and knowledge and attitudes such as this one, if you network with other people in the field. And in particular, I feel that if you have this meaning, this purpose of working in the field, so probably the word ikigai, the Japanese word would be addressing this issue, is something that is helpful, because I think this is an area which in a way also needs, maybe Diego used the term self-selection of people. And if you feel this is your field, this is a call, this is your purpose, then it's probably easier to handle also these difficult cases. And I hope with this that I have shown a little bit of a different perspective of what to do and what not to do in the schools.
Thank you, Vita. Thank you very much. Brilliant presentation, as we all expected to be, and you confirm our expectations. There are several questions from the people to you. I believe that, for example, Nicholas Proctor is very pleased by your presentation, but he is arguing about the role of social media and suicidal behavior, suicidality, and he is remarking that there is lack or limited evidence toward this point. What's your view on this important topic?
Yes, thank you, Nicholas, for this question and also for your comment. I actually agree very much. This is why I try to kind of broaden the horizons of this question, why there might be this different trends, with giving more answer to this question. So I don't think it's we have the answer. I think that in a way, social media can actually also have a very positive aspects to the today's society, because probably this is a way how the youngsters communicate, and if we at least try to also booster good communication between themselves, that's a way how the relationship will probably be formed in the future also. So definitely, I think we need studies that would show more directly the effects. But in a way, it's very difficult to do this kind of studies, isn't it? Because we have all are using this tool, so it would be a little bit. It would require a lot of thought, probably, how to do this kind of studies.
Another question is making the hard question. Where you implemented the project, the program, did you see any reduction in suicidality or even suicidal ideation? Yes.
Well, for our programs, so we have been running the suicide preventive actions since 2009. And there has been a decline in that period at the beginning of our actions, but this was in line with the reduction in the overall preventive decline in overall suicide rates in Slovenia. So it's very difficult to say that our program itself contributed, but our program was also a part of other programs that were similar and other awareness raising actions, and also changes in the quality of life that we have, maybe compared to the 20 years ago. So it went in line, so to say, with other changes that were happening. Maybe it's even more now important how to address these challenges that are in front of us. So do we need to rethink the programs? Do we need to increase the number of them? Because even though we do this kind of program nationally, we don't cover all of the students in a particular year. We do this sporadically in different regions, and we try to kind of manage this very well. So we cover different regions, but we don't have, unfortunately, resources to go to every class to deliver this. Then we could probably talk whether our workshops had an impact on the national level or not.
Very good explanation, Vita, and very honest, humanly and scientifically. Another question, what sort of challenges you met in implementing your programs? How the authorities, families reacted?
Oh, thank you for this question. That's a question I like to answer, actually, because it brings me back to probably 2008, 2009, when we started to knock on the school's door and to ask them if we may come and deliver preventive interventions with the SAIDI project. And at that time, there were not so many preventive actions, or they were not so much structured in Slovenia, at least. There were a few, and I remember, there was a big reluctance of the school authorities to actually let us in. On the one hand, this has been probably linked to the zeitgeist. There were not so many needs, maybe. We were also a very young institute at that time. We didn't have, maybe, if we had a little bit of a different structure at that point, because we have just lost actually our Professor Andrej Marušić at the time. If he was there, probably that would also made the entry easier. But nevertheless, we have received quite some opposition to deliver this kind of workshops in the schools. A lot of times we have received an answer, for example, well, schools are not psychiatric wards. We do not want to address this issue. This is something that healthcare needs to take care of. We are not psychiatrists, we are teachers. And we actually understand that. But I think throughout the last 2 decades of working in this field, we have managed to navigate with the schools what are their needs. And their needs are, I need some protocol how to act in cases when I see a suicidal young person, or I need a protocol of how to act when there is a case of suicide happening in the schools. So now I think there is a bigger wish for us to actually come in the system and to work more. But at the same time, we are also throughout the last decades, of course, networking on the political level. And we can see that the ministries of health, the ministries of education now have more interactions. They try to see that this is a topic that addresses both of the sectors, so to say. Something that we, on the field and in this area, we know that this is the fact, but it's sometimes, at least in Slovenia, it's like this is one area and you work on your area, and this is, it's very separated, and it should be integrated. So now we have seen some progress, and maybe just another point, because I think I see also the families here mentioned. We also had, whenever we go and deliver our workshops, we ask for the parental consent. We give them an informed consent, and the parents need to sign it. And that is particularly for us to also, in a way, have a way how to navigate maybe very potential emergency cases. So when we see there is a child that is maybe at a very high risk, we need contacts to act upon. And we had cases where, of course, parents reacted very negatively to our messages, to our communication with them, that probably there is something happening with the child, or even now we do this a lot of times with the school counseling services, so they are the ones informing, because this is a part of their daily job. But more and more parents, of course, is also thankful that we have identified their kid, that we have provided some support. And also, of course, that they can then follow up with professionals. So Yes, it's. I think for the parents, there are not so big differences throughout the different years. That is something that we didn't see. But for the systems, definitely there has been an improvement in how we talk and how we communicate.
Thank you, Vita. And following the topic on the outcome, that perspective, there is a question concerning the opportunity for the future, at least, to compare school where you implement the program and schools where there is no implementation of the program. So this is something to be done, probably.
And this is something that we have just submitted as a research idea program in January. So hopefully we'll have the funding to actually do some good comparisons. Because right now what we are doing in our evaluation is we evaluate pre and post in data, and there we continuously see an improvement. But of course, we are aware that this might be also because the kids are maturing, maybe because there are some changes in the society and so on and so forth. So we need this comparison group that we would assess twice. But we know from the SAILI study that it was very difficult to do this, to only offer the schools this no intervention, so to say. So we need to have enough funding to do that properly, because of course we need to provide them later on, once the control group has ended this period of intervention, also some preventive activities. We shouldn't let them without anything, because the topic is too sensitive to not address it in an ethically good way.
I believe we may thank Professor Vita Poštuvan for what has gifted us today in terms of this particular angle of humanity, is represented by child and adolescent, a group of people particularly vulnerable to wrong messages and to negative influences. So doing something aimed at helping them is particularly important. It was absolutely interesting to hear what is the scenario of pre and post COVID or during COVID for the state that could provide data on this regard. And also, I believe it was important to see, in relationship with the title of this conference, what not to do in implementing the briefing speeches and activities, how to interact with these people that can be quite difficult to approach, and the situation very sensitive. So all these things were condensed in a beautifully managed presentation. So thank you, Professor Poštuvan. Thank you, Vita.